Okay, cool. So I'm going to talk to you a little bit about dental implants and then what you can do after the dental implant has been placed to ensure its long-term success. So directly after the implant's placed, there's a couple of things you want to consider. As far as pain goes, I just drilled a hole into your jaw and then screwed a screw into it. So chances are it's going to hurt a little bit. It's probably going to hurt between 2 and 3 days and then hopefully get better after that. The swelling is going to be similar. Swelling is going to occur for the first couple of days and then hopefully get better after that. Now, if you have like an increase in pain or swelling anywhere between 4 and 7 days after surgery, and then you just don't feel good, there's a chance you might have a post-op infection and you should give our office a call. You're also going to bleed a little bit after surgery. It's normal for the first day. You may have some bleeding the second day. But if you've got, severe hemorrhaging after the second day, you should probably give my office a call. As far as bruising goes, most of the time if it's just a single implant, there won't be bruising. But if bone grafting or multiple implants are placed, then you should definitely expect to have a little bruising. It's going to show up anywhere between 2 and 3 days after surgery. Hopefully it's gone by 7 days. Definitely hope it's gone by 14. Sutures. Almost always when we're placing implants, and especially if we're doing bone grafting, we're not going to use sutures that dissolve on their own, which means my office is going to take them out. That's generally going to occur anywhere between 2 and 4 weeks after the implant and bone grafting was performed. All right, so the next thing I want to talk about is a strict list of no-can-dos, stuff you should absolutely not do after an implant's placed. The first one is rinsing for the first 24 hours. Don't do it. The second is don't spit, don't suck through straws, and don't poke or touch the surgical site. I mean, don't even pull your lip back to look for the first 7 days after the implant was placed. Don't rub the outside of your face or apply excess pressure, especially if bone grafting was done. Any movement of that stuff could impair the way that it heals. Definitely don't smoke or drink for at least the first 3 days after surgery. But I mean, it would be ideal if you didn't smoke at all before or after the surgery, because you'd have a much better result if you didn't. Don't exercise for the first 5 days or so after surgery. Exercising increases blood flow, and blood flow increases risk for bleeding. I want you to be a couch potato. Sit there and do nothing. That'd be great. Don't do hot foods or hot beverages for the first 14 days after surgery. Especially for the first 24 hours, use cold only. Then after the first 24 hours, you can start integrating some warm food and beverages into your diet, but definitely not hot for the first 14 days. And then try to avoid at all costs spicy foods, chips, popcorn, stuff that get wedged down inside that place where the surgery was done. Or, I mean, worse yet, if you were to bite down on a chip and that thing poked the surgical site, that'd be a terrible idea. And then also avoid carbonated beverages or acidic juices like orange juice or grapefruit juice for the first 14 days after surgery. Okay, so let's talk a little bit next about things you can do to make the implant healing process a whole lot better. If my staff put gauze in your mouth, we want you to apply gentle pressure. We want you to do this for a solid hour. Then you can take that gauze out if you want and switch it with another gauze pack. This can be done anywhere between 30 and 45 minutes. You can switch them after the first one, which needs to be in place for an hour. Make it damp, not soaking wet or dry. You could use a tea bag too if you absolutely needed to. Okay, the next thing you could do is you could put cold compresses or cold packs on the outside of your face. This is especially effective for the first 24 to 36 hours. 20 minutes on, 20 minutes off. Definitely make sure that you put some sort of fabric or cloth between the ice pack and your face, because I did enough damage to you already. We wouldn't want to add frostbite. So let's talk a little bit about your medications. I want you to take all the medications that we've prescribed you according to the way that we want you to take them. The only exception to this is the narcotics. Sometimes they can make you nauseous afterwards. Okay, so as far as your oral hygiene goes, remember you're not going to rinse for the first 24 hours. Then after that, you can start lightly rinsing. Use either the prescription mouthwash, Listerine, or warm salt water. Put that stuff in your mouth, bob your head from side to side. No vigorous rinsing. Vigorous rinsing could dislodge bone graft material or the flap or whatever, or your gums, and that'd be a bad idea. Use a soft toothbrush. If you're real careful and you want to brush around the implant itself, you can use a soft toothbrush, but you got to be real good with your hands, because if you accidentally bump it, you could potentially cause some serious issues. An absolute no is a water pick. Do not use that anywhere near this site where the implant was placed, especially if bone grafting was done. And I'm talking 3 months. Just don't use it near there at all, okay? So let's talk a little bit about your diet. Remember, first 24 hours, everything from food to beverages is cold. Then after that, stick to soft foods, warm for the first 14 days. And if you can, try to make them soft foods. Actually, if you can, make them soft, okay? That's stews, crock pots, slow cooked meat, slow cooked vegetables, soups, you know, you get the idea. Pasta, that stuff's great. Oatmeal, right? And if you can, try to chew on the opposite side where the implant was placed, unless we've placed implants on both sides of your mouth, in which case, just make sure your diet's super soft and you're very, very careful. Okay, finally, I want to talk about some of the stuff that you can do in the long run to maintain your implant. And a couple of things that your body's going to be going through. So for the first 3 to 6 months after the implant's placed, it's going to be going through what we call osseointegration, which is a fancy word for bone fusing to the implant. The time that it takes is variable. I mean, it's based on your overall health, the bone type or quality that the implant was placed in, where in your mouth it was placed, and also if bone grafting was done at the same time. So again, it varies between 3 and 6 months. Which also coincides with the next thing I want to talk about, is uncovering your implant. So oftentimes, if an implant is placed, and especially if bone grafting is done at the same time, we'll try to get coverage completely with your gums so that the implant heals below the surface of your gums and there's less of a risk for damage to be done. If this is the case, then after the implant is integrated, anywhere between 3 and 6 months after it was placed, we'll go back in and we'll do a second surgery to uncover it. It's much less painful. It's usually pretty easy to do compared to the first surgery. Then there's a 2-week healing time frame before, at the minimum, before you can get your final crown. And the final crown and abutment combination, usually the two of them go together, is going to be done by your restorative dentist. Okay, so after you've had this crown placed and you're happy and you're chewing and you're enjoying your implant, you need to make sure that you maintain it. Therefore, we want you to brush and floss. We'll brush twice a day, 2 minutes at a time, and then floss once per day. And you can use a mouthwash too if you want. But just do your best to make sure that you keep this implant as clean as possible. Even though implants can't get decay or cavities, they can definitely get periodontal disease. And then from a maintenance perspective, how often you should see your dentist, you should come in to see us anywhere between 3 and 6 months routinely. And this all has to do with the next section that I'm talking about, which is, you know, potential risk factors and how you can help eliminate them. So one of the major risk factors for early implant loss or implant diseases is a history of periodontal disease. If your parents had it or if you've had it before too, it's one of those things that you can't really get rid of, you can only slow down. And it does put your implants at risk for peri-implant diseases. Like I said before, implants can't get cavities, but they definitely can get periodontal disease. So you want to be following up with us every 3 months if you have a history of periodontal disease to make sure that if something does happen, we catch it early and therefore mitigate the risk of bone loss and potential implant loss. Okay, so the second risk factor would be smoking. We've got a ton of information that shows that smoking is one of the worst things you could do for your gums as well as your implant. So if you could eliminate smoking altogether, you'd do yourself a huge favor. The next one is diabetes, or poorly controlled type 1 or type 2 diabetes. Both of those put you at risk for implant diseases or early implant loss. And then finally, cardiovascular disease. We've got a ton of evidence out there linking the systemic health and your mouth, and this definitely applies to implants as well. So hopefully the information I've given you today is useful and helps you maintain your implant for the rest of your life. All right.